Medical professionals have read it. When did you have to tell a patient I've seen it all before to comfort them, but really you had never seen something so bad or of that nature? Story 1 year ago, my then 11-year-old shattered both femurs and her hip. At the time, her orthopedic specialist was so reassuring and confident that we had no doubts about her recovery. A year later, we went back for a review, and he asked me if I'd like to see her trauma x-rays. Not having any idea of the reality, I said yes. What I saw looked like her leg bones had exploded. After my freaked-out reaction, I commented on how cool and calm he was, and how certain that she'd be fine. He said Head actually had to go for a short walk around the hospital to collect his thoughts since he had no idea how he would put this child back together. He also told me he had used the films as a teaching aid. He's one of my heroes. Story 2, a dog bit my little sister in the face, ripping through her mouth and cheek. It was at a soccer game. She crawled on top of a big dog called a borzoi, which startled it. It rolled over and bit her in the face. This was the late 80s, smaller town. There were no pediatric surgeons available, no plastic surgeons. She was in the ER with her face ripped open. Anyways, our general pediatrician, who is now my kid's pediatrician, 30 years later, who had only graduated maybe 10 years prior, sewed her face back together. It was 30 stitches on the inside of her mouth and 30 or so on the outside. She had a massive scar down the whole side of her face and fast forward 15 years, she grew normally. Her face is fine. Her smile is fine. No long-term damage. Apparently, a face is full of nerves and muscles, and that's why only plastic surgeons work on faces. Particularly with children, having nerve and muscle damage can make their face grow crooked as they age. It is a highly specialized field, but in this case, there was nobody else, just a general pediatrician, and he managed to save her face with no long-term nerve or muscle damage, or even scarring now that she's an adult. We found out 25 years later from our pediatrician's wife that he spent an hour or so crunching his old med school books in the seat of his Plymouth Reliant in the hospital parking lot, studying facial anatomy, nerves and cheek structure, etc. He walked into the hospital and performed a multiple-hour surgery on her face, sewed it back together perfectly. You would think a plastic surgeon did it. His wife told us he came home that night, just flopped down on the couch, and sat there amazed that Head done it, proud but cautious. A new general pediatrician sews a toddler's face back together, and it worked. Now, you would never know it happened, and he has never, ever done another surgery like that again. I'll edit if the tenses seem odd. It is because he was MY pediatrician then, and now that I'm old and have a child, he is our daughter's pediatrician again. And he still calls me by my full first name, which still drives me nuts. We chose him for his excellent medicine skills, not his personality. Thank you all for the golden stories. I will share this with my sister, and probably not him next time we see him, though I can promise you he doesn't know or care what Reddit is. He doesn't even have a computer except the one he is forced to have at his clinic, and he calls it Henry, despite the man who made all the doctors in his pediatrics group carry tablet PCS. Story 3 had a guy that shot himself under the chin with a shotgun. He had actually done it like 16 hours prior to family finding him. He was still alive, conscious, and alert to what was going on. His jaw looked like Predator. I had family freaking out, of course, had to tell them we see worse often, which may be true, but they're usually dead. He lived for almost a day after shooting himself, then died in the back of my ambulance. Story 4, I work in gynecology, and I had to chaperone a male doctor for a pelvic exam. Patient was complaining of pain and discharge. Her vaginal area was completely red and swollen. He then so gently inserted the speculum to get a look, and immediate white cottage cheese-like substance comes pouring out onto his lap and hits the floor. Imagine dropping a container of cottage cheese on the floor. We stare in disbelief. He then had to remove the speculum and use it like a spoon to scoop out more discharge, just so he could get a look inside. He tells her it's a yeast infection and shall be good in no time with the prescription medicine. That day, I learned if you smile while humming, it helps in suppressing your gag reflex. Edit, thanks for the silvers. Edit 2 gold. Thanks so much. Story 5, I was the patient actually. I was sideswiped by a car, then ran over by the truck behind while cycling to work. I was essentially impaled by my right femur, which shattered my pelvis and shoved bone fragments into my guts. Last thing I remember before I got knocked out for surgery was the surgeon telling me everything was going to be fine, and it was all routine. I didn't wake up for a month. When I did, I was missing the entire left leg and most of the muscle tissue in the right. I was too weak to move much, couldn't talk because I had a tube through my neck, and I was very uncertain about reality due to what I went through in my coma. Parades of doctors came to tell me how I should be dead, and it's crazy that I live. I was told over and over that my survival was very much against all odds. My surgeon, on the other hand, never said anything like that. He always maintained that he was going to get me through. His attitude honestly helped when I had to go back to his table a few more times before I was done. For 4 years, I kind of blew off the people who made a big deal about my survival. I adopted my orthopedic doctor's attitude. Then I met a woman who's in the medical field. I fell in love and eventually trusted her enough to let her read my medical records. I had never read them. Because of the massive pile of paperwork, she broke down crying and couldn't read anymore. She told me that the beginning of my time in the hospital was full of the type of write-ups you find in the morgue. She told me that when they opened me up, bits of my pelvis fell out. I asked her to stop there. She won't read anymore, and I don't want to know anymore. I now know my doctor has one of poker face. Story 6. As a medical student doing my first placement in the emergency department, I was waiting outside the triage room to ask the nurse something. I was the lowest ranking, most clueless person in the department. I knew a lot about the Krebs cycle, not a whole lot about, medicine. A young man came up to me and said he was sorry to disturb me. He just wanted to check. It was just, not to cue jump or anything, but he wanted to check, can this definitely wait for triage? He then unwrapped a towel from his hand and showed me his thumb, which he had dropped a loaded barbell onto. It was shattered, just flattened, with splinters of bone coming out. I stared at it. He stared at it. I stared at it. Then I told him, oh yes, no problem at all. Had better take a seat and ID, make sure someone was with him right away. Story 7. Lady came in with possible stroke symptoms, numbness, weakness, difficulty speaking, Gale abnormalities, CT brain unremarkable. Lab work was really odd. We were thinking cancer, so we decided to CT her chest and abdomen as well. Turns out she had a dissection the entire length of her abdominal aorta and going into her right femoral artery. Left femoral had an aneurysm and was beginning to dissect as well. She had formed a massive clot throughout her abdomen that was miraculously keeping her alive. Basically, all of her organs were ischemic dead. About 5 different teams showed up in the ER to see her. After hours of discussion, the consensus was that there wasn't a thing anyone could do. We sent her to hospice. Edit Yell I5 in a comment below. Please don't give me any more gold or silver. Take that money and make a donation. If you don't know where to donate, consider American Foundation for Suicide Prevention. Story 8. Posted this before 4th year med student here. On my ER rotation a couple months back, I walked into the ED and was immediately asked to help a nurse and resident put a catheter in a patient. Now, a catheter placement is usually a one-person job, so I was pretty confused as to why they needed my help. I walk into the patient room and am immediately greeted by a disgusting, rotting flesh smell. Worst thing I've smelled in my life. The patient has to be pushing 400 pounds and has the worst edematous soft tissue swelling from congestive heart failure I've ever seen. His and penis foreskin are about the size of a small watermelon, and the foreskin had swollen completely over the tip of his penis. The nurse had a speculum tool OBGYNs used to look inside vaginas inserted into the man's foreskin while the resident took the catheter in a hemostat pliers type thing and jammed it into the man's pee hole for 20 minutes. They finally got the catheter in and took the speculum out. It was covered in a thick brown discharge that looked like fermented dash. I still don't know how he let his and penis swell that much. Edit, we comforted the patient the whole time and kept telling him we had done it like this before. Total lie. No one in the ED had ever done or seen anything like it. Story 9. ER Tech here. A few months ago, we had an elderly gentleman come in presenting with shortness of breath. As I was getting him into the gown and into hospital socks, I noticed very old, yellowing bandaging around his foot. I inquired to its purpose, and he told me it was a large wound on the back of his heel that wasn't getting better. I asked him if I could unwrap it to inspect it, possibly rewrap it. Basic wound care is one of my duties, and it was a literal hole in his heel about 4 centimeters in diameter, skin necrotic around the edges, with a large flap of skin covering the middle. I wasn't terribly shocked until I swore I saw the skin flap right a little bit. I got the patient's consent to look under the skin flap, and sweet galactic Jesus, there were 3 sizable maggots just chilling. I've read about it before, but I have never seen it in person. My brain went, what in the solar FCK, and despite my attempt at a poker face, the gentleman read my reaction and asked, is it that bad? I was straight up with him and told him that the wound had maggots and needed immediate treatment, and the poor guy started apologizing for bringing something disgusting. I told him, I see this more often than you think. Maggots are actually great at cleaning out dead tissue and are used as treatment sometimes. He seemed relieved by that, but it was definitely my first time ever seeing a maggot-infected wound. Edit, thank you all so much for the overwhelming support, the silver, gold, and the education. This is my first healthcare job, so I definitely have a lot to learn. The patient did have the maggots removed by a wound care doctor and was admitted for pneumonia, if I recall, where his wound was also watched carefully. Story 10. I'm an RN who specializes in wound care. We see a lot of crazy things in my clinic. A common occurrence is a pilonidal cyst, which is an abnormal growth in your gluteal cleft, aka, but crack that contains hair. It usually happens with younger PPL, say 13-20s, and is obviously very embarrassing to the patient. When we get them, they've already had the surgery to open and extract the cyst, so there's a few holes left that we have to heal. One poor soul that came and had the worst post-surgical hole I've ever seen. It was so big, it extended from the top of her crack to the top of her anus, then are on either side about 12 centimeters. It was like the surgeon carved out most of her, but the patient was devastated. I tried to comfort her by telling her she's not the worst I've ever seen. Poor girl. Edit so many comments. I just wanted to add that if this is something you have and haven't gotten it checked out, please do. Also, if you have to have surgery, make sure it's the Bascom procedure. If your surgeon doesn't know how to do it, find a different one. You may have to travel far to find one that does it, but it's worth it. Story 11. Lots of stories, many already covered by others. I will share this particular story with my legs crossed. Motorcyclist came in after some one left turn without checking. He had gone over the hood, slid, and somehow somersaulted, landing on his sitting up. He slid across intersection, mostly on his, getting serious road rash. Luckily, he was only a block from hospital and ambulance. They pack him and bring him to the ER. We end up cutting off his chaps and jeans and begin the cleanup of gravel and sand embedded in his thighs. And when all of a sudden his testicles fall out of his, he had basically sandpaper hole in his while skidding on his. The attending pauses, grabs the saline, irrigates, and nuts, fondles them back into place while humming. I handed him some gauze to pack the wound and smiled at the patient who was under a local. Then I went on break, went fetal and dry heaved. Edit, thank you for my first gold. Story 12. In 2011, I had a saddle pulmonary embolism 2 weeks before my scheduled wedding. My quite seasoned heart surgeon seemed pretty confident that I'd be okay, and he even said he'd get me to my wedding on time. Long story short, I was in the hospital for about a month due to complications. Several weeks later, when I was visiting my heart surgeon for a follow-up, he told me he'd only ever seen 2 other people as sick as I was. Those 2 didn't survive. Story 13. I worked as a tech in the ER for a while and had a woman in her 40s present with burning and pain down below, discharge, and a bad smell. I got the cart set up for a vaginal exam. Got her vitals, blood, and urine. She couldn't pee because of the pain, she said. All the basic jazz you do when someone comes into the ER. I process my samples and let the nurse know everything is done, and she goes to talk to the woman, and it essentially goes as this: no, she hasn't had any trauma, no assault. No, she doesn't know what's going on, but it started about 3 weeks prior. Long story short, we get the DR as the woman refused to let the nurse take a look, and we are all in a room when the doctor turns the light on under the drape and immediately asks if she's been using any medication vaginally. There's clearly a lot of irritation and swelling, as well as a very strong odor, and she hadn't even inserted the spec yet. The woman says no, nothing. At this point, the nurse goes to get some saline, and am left to hand off tools and handle any swabs. The first swab handed to me was literally tinged a pale green, clearly infection. I'm capping it, and the woman smells the odor slowly filling the room finally, and starts apologizing. I had to say, while trying not to gag, no need to apologize. I've seen much crazier things. Just relax, and we'll get you all fixed up. Well, the nurse comes back with saline, and the doctor starts essentially flushing this woman's vagina, trying to clear out all this discharge and infection, so she can see what's going on. And all of a sudden she stops and asks if she's sure she hasn't been putting anything in her vagina to treat any medical condition, even something not given by a DR. And that's when we found out for about a month. This woman had been douching with a bleach and water mix to try and cure a yeast infection, because she read that in hospitals we wash down with diluted bleach to kill germs and thought it would work. She was riddled with chemical burns and infection and was immediately transported to a bigger hospital. So yeah, that happened. Edit, thank for the gold, whoever you are. I've not a clue what it means, but it sure looks snazzy. Story 14. Paramedic here. Had a homeless guy call saying he stepped on a nail about a year ago. I could smell it from the door, so I expected it to be bad. But when I went to pick up the leg by his heel, there was just nothing there. His foot just evaporated into pus and maggots, and his metatarsals clinked through my fingers. While I'm standing there trying to comprehend what happened, he just sighed and asked me to pick up his foot. What foot, buddy? Put it back on. He said it falls off a lot these days, but it still hurts, so that's good, right? I had no clue what to tell him. The nurses thought it was hilarious that the baby medic thats me BTW got grossed out. Edit, yay, my gold cherry has been popped. I'm a baby medic no longer, at least on Reddit. Story 15. Had a patient who needed a lower GI study to fix a bowel bleed. To get a study done, you need to clear mucus. 3 days we bowel prepped with heavy laxatives and enemas. He barely pooped anything. He puts on the call light at 6:45, 15 minutes before my shift ends. He calmly says, I kind of want to try, and he said it so casually. I figured he was going to toot out another gas bubble and walk back. He stood from the bed, took one step, and the floodgates burst. 3 days of the most rancid liquid stool I had ever encountered. It just wouldn't stop. He left a river of stool from the bed to the bathroom, coated the walls as he bent to park his butt on the toilet, and continued to dump out 7 people worth of. In my 9 years, I have never seen that much come out of a person. He was not a large man. He was so embarrassed, but I just kept my face as solid as possible, grabbed half the linen closet and 3 packages of KY wipes, and sopped it up. Told him this happens all the time. Edit thanks to my first gold. Edit to my edit thanks to my first platinum, and all the kind words. I love what I do. Story 16, I used to do psychiatric evaluations in an emergency room setting. One time, I'm evaluating this 60-year-old woman who is lying in the hospital bed. I'm asking her questions, and she stops me and says, "Excuse me, but I need to pass some gas." I'll let her know that this is a medical setting, and that is a completely normal body function, and not to be embarrassed. People pass gas all the time. I was not prepared for what came next. She let it rip, and out came the loudest, wettest, and longest sounding I've ever heard. It was bubbly and juicy, hitting all the deep notes while ending on a squeaker. I don't think Satan could have made a noise like that with his anus. It sounded so relieving, but then the smell hit me. It was bad enough that I started to gag and had to excuse myself in the room. When I came back, I politely asked if she needed a nurse for anything in case she needed to be cleaned up after that, but she declined. Obviously, I've witnessed people farting before, but I've never heard or smelled anything like that before. That was something else. Story 17, nursing corrections here. Had an inmate patient come in with complaints about severe lower abdominal pain. He told me that he had something stuck in his prison pocket. Before I could ask him what he stuck up his anus, he bends over and shows me a cord sticking out. I told him, "Don't trip. I'm sure the doctor can help you out with that. You'll be all right." Come to find out, the prong of the phone charger got caught up into something, and it was stuck. As I was trying to comfort him, I started to hear this vibrating sound. So I asked him if he heard it do. He said, "It's the phone inside me that's stuck with the charger." It wasn't just a regular flip phone. It was one of those Samsung smartphones. Story 18, honestly, it was usually when an alert-oriented person pooped themselves, could have filled the bed and be running onto the floor. You still maintain that, no, don't worry, we do this every day now. Let's just get you clean, all right, facade? Edit, thank you for the gold. You know who you are. Edit 2, for clarification. I don't mean alert people who deliberately soil themselves or the bed. I mean alert but ill or disabled in some way. They can't control and they're probably terribly embarrassed. Story 19, when I was a med student on the trauma service, there was a gentleman who decided to attempt suicide using a shotgun aimed at his heart. Unfortunately, the first thing that comes out of a shotgun when it is fired is a gust of air, which changed where the gun barrel was pointed when the shot came out. The shot pellets ended up hitting everything but his heart. Lungs, ribs, spleen, stomach, liver, pancreas, and large and small intestines. In the OR, the attending surgeon told me to put my hand on his beating heart, because that will likely be the only time in my medical career that I would touch a beating heart. I did. It was cool. In case anyone reads this in a thread with 1,500 posts, he survived, though. He was on the trauma service for the entire month I was there and was in the hospital for a long time further. Story 20, young man, 18, apparently comes in about something else, trying to work up courage. Right before he should actually be leaving, this could be really annoying if there are people waiting. He says, "I need your advice. I'm having with my mother." What do I say? "Oh my God." No, I didn't. I said, "This isn't the first time someone has told me this." This wasn't true. Turns out that he knew it was wrong. That mother had initiated it. He was trying to extricate himself, and he was desperate for help. But the thought that someone else had been in his position meant to him that he hadn't been judged, that he wasn't doomed or would go to, and that there was hope. But he didn't know what to do, because the person to whom he should have looked for advice was actually his abuser. But the lie helped defuse the situation. Story 21, a little late to the party, not the worst. But I had a patient once with a stomach bleed and a small bowel obstruction. We had to put an NG tube that goes in your nose and down to your stomach to drain to compress his stomach, which was pretty distended and hard. I'm inserting the tube, and as soon as it hits this guy's gag reflex, he projectile vomits and sprays very dark, half-digested blood all over himself. The bed, the wall, and the floor. It's basically a scene from The Exorcist. I had to dive out of the way and somehow was unscathed. He couldn't stop for almost 10 minutes as we're trying to get this thing down to where it needs to go. Finally finished placement, and it immediately suctions out 3 liters of this black sludge that is old, digested blood. Point was mortified, and we had to play it off like, "Oh no, it's fine. It's really common to vomit during the procedure. We'll just go get some towels and clean you up." My coworker and I left the room and just stared at each other in silent shock. Story 22, I had to have my leg rebuilt after a car accident and was eventually sent to Duke University for my surgery. My surgeon was supposed to be like the best orthopedic surgeon in the country. I think he used to work for the Baltimore Ravens. Anyway, all the doctors from my hospital at home were very unsure if I would even have a functioning leg, let alone walk normal again. The first appointment at Duke, that dude told me it was really not a big deal, and he would have me fixed almost good as new. I honestly thought he was just trying to be nice and optimistic, but he was very serious. 5 months later, I was walking and learning how to run again. He said I was one of the most complicated surgeries he has had to do, and a group of surgeons flew in to observe him do it. Story 23, I'm the patient here, and the nurses didn't even try to say they had seen it before, but it still fits. When I was getting treated for cancer, I got a really bad case of pneumonia and had to be intubated and put into like a semi-coma type deal. I don't remember anything that happened in those 6 days, but I was apparently made sober enough to open my eyes for visitors every day, so I don't know if that counts as a coma. It was some pretty serious pneumonia because it was like less than 2 days between my first cough and them making the call that I would need to be intubated to stop me from drowning in my own fluids, so they didn't mess around and gave me a ton of antibiotics. You know how some hospital beds have a track along the ceiling that they can hang 4 bags from? I had enough antibiotics hanging from mine that it broke and fell to the floor again. No memory of this. But the thing that was truly unprecedented occurred when they were changing out my butt bag. I don't fully understand what it was, but they had something on or under but that collected all my bowel movements. They put it on after I was heavily sedated and removed it before I was totally awake, so I don't really remember it. For anyone who doesn't know, antibiotics can cause a lot of diarrhea. Apparently, when they rolled me on my side that day, I let loose a fire hose of liquid that arched through the air across the room and splattered all over the door and window, which were about 12 feet away from my bed. I think it's super cool and funny, so they didn't have to pretend like it was normal to comfort me. Edit WOO, new most upvoted comment. Story 24, medical student here, had a first-time mother who was having difficulty nursing because her nipples were chafing pretty bad from the baby teething constant moisture to the area. Before showing me and her OBGYN the problem, she apologized that I had to see it probably because I'm male, but I told her I've seen plenty before, especially in the ER. While not the worst thing I've seen, gunshot to the head takes the cake. I don't think I've seen skin so badly chafed before, and it looked like she might have had the beginnings of mastitis on one of her breasts since it was red, warm, and very tender. The nipples themselves just looked raw and extremely painful. Story 25 happened to me. Not a medical professional. Friend of mine bought a house, and I moved in with him to help fix it up, polish it, and then maybe sell it. So we're in the backyard pulling weeds and cutting down vines, and I see this 4-inch diameter vine with fuzzy roots attached to the brick, climbed all the way up the wall. I'm not a particularly country boy, more urban, but my friend had warned me of poison ivy in back of the house. I called him over, and he said, "Oh, don't worry, it doesn't grow that big." He was wrong. Less than a week later, I'm covered up and down both arms bad enough. I look like a third-degree burn victim. It has gotten into my bloodstream and appeared on my legs, back, chest, and even my feet, which all have been covered, of course. I remember my GP looked at me with my shirt off and said in the most nonchalant voice, "Oh, that's not quite the worst I've ever seen," with serious emphasis on the one word. It took me 2 weeks of steroids to even return to work and another 2 weeks to lose the last of the boils. I spent that time researching poison ivy, and I have to brag, I'm an expert on how to track down and murder that plant. I hate poison ivy. Edit, people are asking me for tips on killing the stuff. Go to your local hardware store and they will sell a container of poison ivy killer. The stuff is good, but if you use it as directed, I can guarantee the stuff will return time and again to haunt you. The vine originates underground. Not very deeply, though. Dig around while covered in protective clothing, etc., and find a main trunk of the vine. Drill holes through the vine about half the diameter of the stalk and space them about 3 to 5 feet 1 to 2 meters apart. Pour the poison ivy killer directly into the hole. Do not dilute it. Just pour it right in. Soak the vine well, maybe 50 to 100 milliliters or 14 to 12 cup, depending on the size of the vine. This should do the trick. Of course, it will need to be dug up and out, but it ought to be pretty dead within a week. If that doesn't do it, repeat the process a second time. Also, do this when there is no rain forecasted. Good luck and kill it dead. Edit 2. Also, it seems everyone either has a story about getting it all over and hating "I'm so sorry for you," or telling how they are immune to it. Fun fact about that. Allergies change. You could be immune all your life, and then one morning wake up allergic to just about anything. Funny story to illustrate this. I told someone about my poison ivy situation once, and she told me about her little brother, who was apparently not allergic. He would play pranks by grabbing it and rubbing it all over himself to try to convince other people that it wasn't poison ivy. He pulled the prank one day and had a wedding to attend 2 days later. He suddenly developed the allergy under the suit. Moral of the story, kill the plant when you find it. Evil, evil little. Edit 3. Last tip, I just remembered. If you go out in the woods and suspect you're going to encounter poison ivy, etc. at all, Bring a can of spray deodorant with you. The aluminum chloride, I think that's the chemical and it will neutralize the oil and prevent allergic attack. Otherwise, scrub with soap and water within 10-15 minutes after exposure. Story 26, not a medical professional, but my mom is an RN, and boy has she had some stories over the years. Yet, one in particular stands out. She had a male patient come in with an ahem, extremely swollen penis, like the size of a Pringle can swollen. She said it was the biggest penis she ever encountered in her decades as a nurse. He claimed he broke it during. She had to put a catheter in. The guy was freaking out, and she had to reassure him that this was a walk in the park for her, but she was seriously questioning how to get the catheter in. She called in her co-worker to help steady as well. Also, so someone else could just witness what she was seeing, while she gave him every painkiller she was legally able to give and stuck the catheter in. Got in the first try. Thankfully, she still doesn't know how she managed to get it in, but was thankful she did. Well, eventually it came out that he hadn't broken his during, but actually masturbated after cleaning his fish tank without washing his hands and got an infection from it. Story 27, I have a story. I've been an RN for 12 years now. Seen a lot of, I was particularly lucky in nursing school and got to watch open heart surgery, joint replacement, kidney removal, all kinds of neat stuff right over the surgeon's shoulder. The only one that ever gave me a problem was this kid about 10 years old getting his tonsils removed. The doc had this hook knife. He's reaching into the kid's mouth, hooked the tonsil, and it back to cut out, blood flying out of the unconscious kid's mouth. So I'm standing there, I look up, and all of a sudden everything's getting sparkly. I just said I need to leave. Right now, surgeon takes his tools out of the kid's mouth and says, "Okay, someone please walk him out. Thanks." So I learned that for some reason, I get queasy when it's kids being hurt, which is funny because I was a pediatrics nurse for quite a while after school. Anyway, the actual story. I wasn't even at work, but maybe 4 years ago was living with my girlfriend at the time and her 3 young boys. That day, the youngest, about 7, had been climbing up a big lilac bush in the yard that I'd trimmed the day before. He slipped and fell out. A sharp, cut branch caught him in the face on his way down. I was in the kitchen and heard this blood-curdling scream and ran outside. I brought him in, sat him on the kitchen table, and took a look. It seemed like he was pretty lucky. There was just a deep cut on the bottom of his nose. Well, it was bleeding pretty decently, so his mother and I took him to the emergency room. We get there. There's only a physician's assistant on duty. He takes a look and thinks maybe it could use a couple of stitches, or he says he could call the on-call ENT surgeon for another opinion. We told him that, all due respect, we would like to have a surgeon take a look just in case. Good thing we did. The boy had nearly taken his entire nose off his face. The stick cut up under the nose and traveled along under the flesh up to the bridge. The entire nose was hanging by a ½ inch of skin at the top. We just hadn't moved it much. As soon as the surgeon came in and pulled this little boy's nose off his face, while he's laying on the exam table screaming absolute murder, suddenly I got really hot. Things start getting hazy. I realize I'm about to pass out. So I quickly exited the room and sat down at the exact same time as my girlfriend, who was also a nurse. Neither of us could take it. Story 28, not even close to a medical professional, but my aunt is a nurse and told me about a guy who came in coughing up blood and maggots, and it turned out to be some worms he got from eating something that ate through his stomach lining into his esophagus and were in his throat. Story 29, not a medical professional, but I have impressed a couple. It's not super weird, but just uncommon, I guess. I was overweight but active when I was younger and broke my lowest rib while snowboarding. Long story short, I did not know it was broken honestly, so I never got it checked by a doctor. The rib traveled up over the next 2 ribs and has since fused to them. I now have a permanent tilt on my spine where this rib attaches to it, and now that I have lost some weight, a bump you can feel on my chest. It is kind of weird when you tell a doctor about something on your body, and their face lights up like a kid on Christmas, and they ask for permission to feel it. Story 30 years ago, 2000, I was playing soccer and noticed a little skin irritation underneath my arm. I thought it would go away, but it developed into a weird thing. It was about 2 in diameter and grew to be a collection of essentially looked like hundreds of skin tags grew together in a little circle. I went to the doctor who didn't have a clue, and he sent me to a specialist. While there it seemed like he didn't know either, this was further evidenced when 4 other doctors came in to take a look and were really interested. They took a ton of photos and told me they hadn't seen this before and couldn't really offer any medication and said they would monitor it. About a week later, the skin tags developed little circles on the top that turned into scabs within a couple days. Then the thing just kind of dried up and fell off me. It was weird, and to this day, I have no idea what it was. I was not comforted.